Hello and welcome. If you are someone who's been on the fence about CBD and perhaps want to learn more about it and even get a physician's take on it, then I hope you stay through the entire video because that's what this video is about, and I hope to educate you as well as basically shed my opinion about it and answer hopefully some of the questions that you have along the way. So without further ado, let's get into it. Thank you so much for tuning in. I hope that you will learn a ton from my videos. This channel will mainly be focusing on health and wellness, but we will first be starting off talking about a series of videos that will basically be talking about the details of the cannabis plant and CBD. And I hope you'll stay with me. And if you do find this content very valuable, then I hope you will like, subscribe, as well as hit that notification bell so that in the future when I post another video, which I hope will be about every week or so at the very least, that you'll know and we can continue our education. But before we get into all that, who am I? Who am I to stand here and talk to you guys? I am Dr. Jack, and I am double board certified in anesthesiology as well as pain management. I have been in clinical practice for the last 12 years, and I've learned a thing or two. And one of my latest passion has been learning about the cannabis plant and CBD. Hence, I figured I'd start this channel off this way. And so, please feel free to comment in the sections down below to let me know what you guys find interesting, what works, what doesn't work, because this is my first YouTube video and don't really know what I'm doing here. I just want to kind of get the knowledge out and just basically try and educate people, if you will. So, one of the things when I was setting up this channel also was trying to figure out how to go about this and the vibe that I want to set. So, I thought about approaching this in a very professional manner, kind of like this. Hello, I am Dr. Professional, MD. It's very nice to meet you. Or like this. Hi, I'm Dr. Cuts. It's very nice to meet you. But ultimately, I decided that this will be a channel where I can just speak to you as well as just have a very laid back, casual atmosphere where I can be myself and, kind of leave that office environment and just educate, entertain you, and hope that you find value in everything that we talk about in all of these videos. So without further ado, let's jump right into the main topic at hand. First off, as a disclaimer, anything that I say here, please take it for what it's worth. Do your own research. Speak to your medical provider as well if you have any questions about anything that you think is unsafe or have questions about. So, where does my journey with this amazing plant begin? Well, it actually started way back in my training when I was in fellowship. And so I remember I was in clinic and there was this couple. They were this power couple that walked in, and if you live in Manhattan, everybody's somebody up there. And this couple, they were, I think if I recall correctly, they were each their own CEOs of their individual companies. So highly functioning people, obviously. And they came to me because they moved from a place where cannabis was legal, and they both treated their myofascial pain and fibromyalgia-like pain with cannabis. And they did extremely well. They tolerated it and they were highly functioning, but obviously they moved somewhere and it's illegal. And so they wanted to follow the law, and they ended up going to a pain clinic for their pain. And I just remember talking to them and finding how high functioning they were, and went and spoke to my attending about it afterward, and he was like, well, they've tried everything else, this is really the only route to go. And that route was to give them opiates or narcotics, if you will. And I just remember feeling, I don't know if dirty is the right word, but I just didn't feel right. Here was this couple that was getting along very, very well and obviously very successful and without any side effects or any complaints about the treatment they've been getting through cannabis. But here I am saying that, no, you need to stop that. But here is some opiates. And I mean, with everything that we know about opiates in this day and age, which is a whole other video talk in and of itself, but with everything that we know about the downsides of it, as well as the side effects and long-term consequences, it just didn't feel right. And so, you know, throughout being a pain physician in my career, I obviously encountered many other people that treated pain with cannabis and found great success. And you know, it just kind of chugged along for a while up until about December of 2018, shortly thereafter. So I remember the beginning of 2019 where there were more and more patients that started showing up and were taking something called CBD. And CBD this, CBD that, you know, you know, those guys that flipped the little signs on the side of the road, they were advertising as well. There were billboards about CBD, commercials, everyone and their mother was making CBD. And so I found that patients were asking me a lot of questions and I couldn't answer them, basically. So, you know, I had a week of vacation. I decided to take that week and just take a deep dive and learn absolutely everything I can and look into the research and figure out where to go from there. And as I dove deeper and deeper, my mind was just blown, basically. And there's so much to learn about the cannabis plant. And I never knew what I didn't know, basically. And as I started reading more and more, I was also fascinated by how much research is already being conducted by people like Raphael Mechoulam and Ethan Russo, these doctors and scientists that have been suggesting cannabis for all sorts of things. And they've been conducting research looking at how cannabis affects all types of different diseases and various things and publishing all this paper. It's all there on the internet for everybody to read. So I suggest going in, you know, if you ever want to look up anything in regards to this or anything else, just go to Google Scholar and punch in or just punch in the search up top. Like say you want to research CBD and fibromyalgia or something, and it will pull up a ton of papers for you, because that's how I basically got started. I can also suggest a few books to you as well. I can link those descriptions down below for you to take a look at if you want to further your education even more. As I was doing my research, I just was blown away by learning about things such as the endocannabinoid system, the entourage effect, and there were all these various other things like terpenes and flavonoids, and you know, how exactly you're supposed to take it. Do you take it sublingually? Do you take it as a pill, vaping? And there were all these little nuances to sort of understand and what exactly makes a safe and high quality CBD product. And if any of you have ever walked into your standard hemp store, it's a little overwhelming, right? I mean, you walk in and it's just like, I mean, this whole wall of products there. And I mean, at least that's the way I felt when I first walked into one. And it's just very, very overwhelming. And so I started experiencing a lot of patients that would come in and basically they were afraid to take it because they didn't know where to start. And hence the whole point of this entire series is to talk about all of this a little bit further. Today we'll just be kind of brushing up on all of that. Today, consider this video more as an introductory video, if you will, about what there is to talk about down the road. And also, you know, I'm sure you figured it out by now, but my opinion as a pain physician is that this is an amazing plant and that we are just now scratching the surface. And there is a lot more to learn about it. And I think people will be surprised about what future research is going to show. So one of the questions I get asked by especially other physicians is, well, why are you so interested in CBD or the cannabis plant in general? Well, the reason is that it's because I've sort of seen what my patients have been telling me in regards to what they are taking it for. And you know, in the beginning, I kind of said that this CBD product is like the kind of modern day snake oil, you know, or like, I don't know if you guys watched The Big Fat Greek Wedding, where they use Windex to spray and, you know, treat, or, you know, it seems to remedy everything. Well, I mean, that was how all these patients that were coming in seemed to tell me that they were taking CBD for all kinds of things. You know, they were saying that, oh, well, it helps with sleep. It helps with restless leg syndrome, anxiety, mood, inflammation, pain, IBS symptoms, and all these things. They were all telling me that their symptoms seemed to be lessened when they started a high quality CBD product. And that was really why it piqued my interest. And, you know, as a pain doctor, the thing that really fascinated me was that I found that some patients were able to reduce their opiate usage. And so, you know, don't get me wrong, I'm not anti-opiate, but I think opiates definitely help some chronic pain patients, but I think that the long-term consequences and side effects of opiates leave a lot to be desired. And so I thought that was great that some people were able to do that. And, you know, I've also noticed that in regards to the chronic pain syndrome. So what is a chronic pain syndrome? The syndrome of basically where, well, if you have chronic pain all the time, you're probably not getting good sleep. You've probably developed some type of anxiety towards the pain. I think it's only natural. And obviously there's pain and inflammation, and it's going to put you in a bad mood, right? So, you know, I have seen in the years, you can give me the most normal patient and you give them chronic pain. You know, it may not happen overnight, but over a period of weeks, months, years. I mean, just imagine if from the minute you woke up, let's say I was like poking you in the back with a hot iron stick. And so, I mean, you know, in the beginning, it would just be annoying, right? But after a while, it starts to affect every facet of your life. And so think about what I just said of what's involved in the chronic pain syndrome. And CBD, there is research to show that, you know, some people have reported various results in all of those facets in regards to sleep, anxiety, mood, pain, inflammation. And so what I've noticed clinically is that it may not directly help with their physical pain as much as it actually helps with them to cope with the pain, if you will. So if you're someone that's lived with chronic pain, then you have the chronic pain, most likely have the chronic pain syndrome. You know, the things that I talked about, such as the sleep issues and the anxiety and the bad mood, if you will, the moodiness. And so if something is able to help you deal with all those facets of the syndrome, then you're able to kind of live your life and cope with the pain better, if you will. And that's what I've actually noticed about CBD and how it's helped people. And, you know, I think CBD also is just the surface of this amazing plant called the cannabis plant. And just to be clear, cannabis, there are basically two forms, right? Marijuana and hemp. So hemp has been defined as less than 0.3% THC, which is the federally legal amount that's been set, and that is where the CBD comes from. And real quick, let's also talk about the safety profile about CBD. And with CBD, what I've noticed clinically is that it's very little side effects, and it doesn't seem to interact with a whole lot of drugs. And now I know that, you know, if you go searching on the internet, there will be things talking about, oh, it might cause liver disease, it could interfere with these other drugs, and we'll get into all that kind of down the road in future videos. But in my experience thus far, I have not seen that with the very small amounts that the average person takes to anything that is clinically relevant that I have seen so far. But as with anything, talk to your physician or medical provider if you have any questions in regards to this. So that concludes my very first YouTube video. So if you're still there and watching, thank you for continuing to watch. I hope that you learned a lot off of my very first video. And again, please hit the subscribe and notification button. And if you can, hit a like on the video as well. It really helps out a lot. And because I plan on creating several more YouTube videos after this focused solely on the cannabis plant and CBD in particular at this time, because there's just so much to know. You know, we'll be taking a deeper dive talking about things like the entourage effect, talking about terpenes, flavonoids, what sets a high quality CBD product and safe product from others. We'll talk about the research that's being conducted currently. And there's just so much stuff to talk about that there's no way I could do it in one video because you guys would probably be all snoozing by now. And so anyway, thanks again for tuning in, and I will see you on the next video. Take care, stay safe. Bye-bye.